At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. Estradiol, a hormone produced by the adrenal glands and ovaries, is the most common type of estrogen and a key female sex hormone. It's crucial for sexual development, reproductive health, and maintaining pregnancy. Our estradiol levels chart visually represents the typical cyclic fluctuations of estradiol levels throughout a uterine cycle. These fluctuations vary based on whether an individual is prepubescent, premenopausal, pregnant, or postmenopausal, reflecting the wide range of normal estradiol values. Instead of just listing numbers and ranges, this chart shows average estradiol levels over 28 days, providing a clear and concise reference. It's a valuable educational tool complementing estradiol blood results, the comprehensive visual guide. The Estradiol Levels Chart is essential for healthcare professionals to understand estradiol hormone fluctuations. This chart is handy in various clinical scenarios and provides valuable insights for patient care. Monitoring menstrual health. For patients experiencing irregular menstrual cycles, this chart helps assess estradiol levels across different phases of the menstrual cycle. Fertility assessments. In cases of infertility or when assessing ovulation patterns, the chart can guide understanding estradiol's role in ovulation and reproductive health. Menopause management. This chart, along with a menopause hormone levels chart, helps evaluate symptoms related to menopause and premenopause by tracking estradiol levels. Hormone replacement therapy. For patients undergoing hormone therapy, especially in transgender healthcare, the chart is crucial for monitoring hormone levels and adjusting treatment plans. Evaluating hormone imbalances. The chart provides a framework for understanding estradiol variations and diagnosing conditions like polycystic ovary syndrome or estrogen dominance. The Estradiol Levels Chart is a straightforward and efficient tool designed to assist healthcare professionals. Here's how to use it effectively. Enter the patient's name and the date at the top of the chart. This ensures clear identification and record keeping. You can access our template in the link in the description or through our Carepatron app, which is free to sign up for. Record the patient's estradiol levels in the designated space. It's important to note the measurement units used in the blood test results. If relevant, indicate the phase of the menstrual cycle during which the estradiol sample was taken. This context is crucial for accurate interpretation as estradiol levels fluctuate throughout the menstrual cycle. Specifically, estradiol levels rise steadily during the follicular phase, peak before ovulation, and drop after ovulation. Utilize the chart to compare the patient's E2 levels against standard estradiol ranges. Consider the patient's specific health context and add your professional interpretation and any pertinent notes in the provided space. Understanding the normal estradiol levels is important for accurate interpretation and effective patient care. Here is a sample of our estradiol levels chart to give you an idea of how you would use it in your practice. To discover more of our free templates, explore our templates library, which you can find on our Carepatron website linked in the description below. Carepatron is a practice management software known for its comprehensive features. Signing up is free. Just click on the sign up link in the description. If you enjoyed this video, don't forget to press the like and subscribe button for more content like this.